Hey guys, my name is Luke and I suffer from trauma and addiction. Trauma doesn't always announce itself. It doesn't always show up as loud, dramatic moments. Sometimes trauma is quiet. It's growing up in a home where emotions weren't safe. It's a relationship that broke you down. It's losing someone before you had the chance to say goodbye. And when these wounds stay unresolved, they create cracks in our emotional foundation, cracks that we often try to fill with something, anything, that makes the pain a little easier to carry. That's how trauma and substance use become linked. Not because someone is weak, not because they lack discipline, but because trauma teaches the brain to seek relief, fast, intense, and immediate. Alcohol, drugs, pills, even behaviors like gambling or compulsive sex, they become coping tools. They become ways to temporarily silence memories, numb emotions, or escape the weight of what you've never been allowed to process. This cycle creates what I call the trauma trap. Here's how it works. The trauma gets triggered, overwhelming emotions show up. The person reaches for something to suppress the feeling. The relief is temporary, shame kicks in, and the trauma remains unhealed, round and round. And each time, the spiral gets tighter. So how do we break this? We start by understanding. You can't heal what you refuse to feel. And you can't feel safely unless you create a space where honesty, vulnerability, and compassion are allowed to exist. Healing trauma isn't about digging up the past. It's about finally giving your nervous system permission to stand down, to breathe, to feel, and to release. Therapy helps, support groups help, journaling helps, and community, real community, is one of the most powerful healers we have. Trauma may explain your behavior, but it does not define your future. You can choose healing, you can choose recovery, you can choose you. Follow, like, and subscribe to The Inner Fix for real talk on mental health, substance abuse, and recovery. You never have to face your mental health alone.